Welcome back, everyone. In this next section, we're going to be talking about different types of terms to understand all the different body parts, okay? So in order to understand the terminology of how we get to some of the names of muscles and names of bones, we have to, and to label things properly, um, we have to have a starting point. The starting point is referred to as anatomical position. So whenever we're looking at a person, we have to start from this position where this young lady is standing with her feet on the floor. She's standing erect with the palms facing forward or facing anteriorly. So whenever we hear this word anterior, anterior, it means the front. So we're looking at this woman from the anterior, from the front. Her palms are facing anterior. We're looking at her trunk, her front of her thighs, her legs, all from the anterior. This is anatomical position where the thumb is laterally, which means it's pointing outward, and her pinkies are on the medial side, meaning the inside. Okay, her first digit, or the thumb, or digit 1, is lateral, and her fifth digit, the pinky, number 5, is more medial. So see, so now you're hearing a lot of terms that you may not have heard before. You've learned anterior, we've learned posterior, which is the back, lateral, which it means it's away from midline, medial, meaning it's closer to the midline of the body. So some new terms here. So anatomical position, we've learned it's the hands at the side, palms facing forward, feet flat on the floor. Let's look at these two terms, supine and prone. They both refer to the individual lying down. It's just supine is when you're face up and prone is when you're face down. So the way you can remember this is prone is when you're lying on your bone, which is the nose. So when you're pronated, prone is lying on the bone, whereas supine is when you're lying on your spine. Okay, supine is lying on your spine, whereas prone is when you're lying on your bone, the nose. So supine is lying face up. Prone is when you're lying face down. Supine is the opposite of prone, and prone is the opposite of supine, right? Pretty straightforward, nothing too complex. Standing upright with the palms, feet flat on the floor, and the palms anterior. Anterior, that is anatomical position. You're standing upright, feet flat on the floor, that is anatomical position. Let's look at some other terms here that are important to know. When we talk about this part of the skull or this part of the head, that's called frontal. So when we do osteology and we cover bones and we talk about the frontal bone, you'll know where it is. That's the frontal bone. When we talk about muscles and we get into the cheek and we learn about a muscle called the buccinator muscle, you'll say, wait, buccinator, I wonder if that has anything to do with the buccal, and I do buccal means cheek. So cheek and buccal. When we talk about the nose, it's nasal. So when you learn of a muscle called the nasalis or a bone called the nasal bone, you'll know where it is. The eye is called ocular or orbital. The ear is called otic. This part of the head is called a cranium, whereas this part is called facial. So there are facial bones and there are cranial bones. There are facial muscles and there are cranial muscles. When we combine both cranial and facial, we use the word cephalic. When we talk about the neck is cervical. We have 7 cervical vertebrae. When we talk about the armpit is axillary. So when we get to blood vessels, and we talk about an axillary artery and an axillary vein, you'll have an understanding as to where it may be. The arm is brachial. So when we do a muscle called the brachialis, you'll know where it is. When we learn about the brachial artery, you'll know where it is. The elbow, in front of the elbow, right here, it's just called antecubital. So when you learn of a medial antecubital artery, you'll have an idea where that is as well. Now, everything in here in the middle is called a trunk, and the trunk has a few parts. It has the chest, known as the thoracic region. It has the breast, called mammary. It has an abdomen called abdominal region. And then it's got the belly button called umbilical. So this has shown up before on the McGraw-Hill quizzes, and it's like a drag and drop. Typically off to the side, you'll have all of these words, and you'll have to like click on one of them and then drag it over to the right place and let go and drop it. So this is the frontal bone. The eyes are orbital, nose is nasal, ear is otic, cheek is buccal. The chin is called mental. So that when you do osteology and we see a hole here and a hole here, these holes are called foramen, and the ones in the chin are called the mental foramen. Mental foramen. Okay, so now there's two left over that we haven't done, but by process of elimination, you should be able to figure it out. So right here, we see the delineation of a muscle, and here's another muscle. These muscles are called the sternocleidomastoid, or the SCM muscle, sternocleidomastoid. And then right here, there's a triangle. And then over here, there's a triangle. So the one in the front, anterior, and neck is cervical. So it's an anterior cervical triangle. And then here's the trapezius muscle. So in front of the traps, but behind the SCM, is another triangle, and that would be called the lateral cervical triangle. Anterior is in the front, lateral means it's away from midline. Okay, let's look at the lower part. When we look at the wrist, well, you've heard of carpal tunnel syndrome. So we have 8 bones of the wrist. That's called the carpal bones. The palm is referred to as palmar. The digits are called phalanges. The thumb is called pollex or pollicus. Now let's skip right down to the foot for a second because the hand and the foot have some similar names. In the hand, we had 8 carpals or wrist bones. So carpals are in the wrist, whereas in the foot, we have tarsals. There are 7 tarsal bones. Tarsal is ankle. The toes are also called phalanges, just like they were in the hand. But notice that the thumb was called pollicus, but the great toe is hallicus or hallux. They're interchangeable. So when we do muscles of the thumb and you hear of a muscle called the flexor pollicus longus or adductor pollicus or abductor pollicus, you'll know pollicus refers to thumb. When we do foot muscles and toe muscles, when you hear of a muscle called extensor hallux or extensor hallucis longus or flexor hallucis brevis, once you hear hallucis or hallux, you'll know it refers to the great toe. The foot itself is the pedal foundation, which looks like pedal, right? Pedaling. That's the foot. The kneecap is called patella. The leg is called crural. The thigh is called femoral. And that's because the bone here is the femur. The femur is the longest bone in the body. Where the pubic bones are and pubic hair, that would be the pubic region. And where the groin is, right here, that's the inguinal region. From the posterior, here's the word posterior, which means we're looking at the person from the back. The back is also known as dorsal, just like the dorsal fin of a shark or the dorsal fin of a dolphin, right? Dorsal means back. The neck is cervical. We have 7 cervical vertebrae. Cephalic refers to the entire head. The highest part of the shoulder is called acromial. So when we do the scapula bone, which is here, when we do the scapula, we will learn that the highest part of the scapula is called the acromion process. Okay? The back of the elbow is called olecranon, and this specific bone, when we do osteology, is called the olecranon process. So learning these terms are going to be really important, okay? The lower back is called the lumbar region, and we have 5 lumbar vertebrae. We had 7 cervical vertebrae, 12 thoracic vertebrae, and 5 lumbar vertebrae. So you have 7 cervical, 12 thoracic, and 5 lumbar. Neck, mid-back, lower back. When you add those up, you get 24 freely movable vertebrae. Okay, when we look at the tush, when we look at the rump, that's the gluteal region. So that when we do muscles of the buttock region, we will learn muscles called the gluteus maximus, the gluteus medius, the gluteus minimus. So gluteal, you'll know that those muscles are somewhere here. The back of the knee is called popliteal. So when you learn of the popliteal artery and popliteal vein and popliteal nerve, you'll have an idea as to where they're located. The calf is called sural. The heel is called calcaneal. And that's because one of the tarsal bones, the largest one, is called the calcaneus. So this region is calcaneal. The bottom of the foot is called the plantar surface, the plantar. Remember, the palm of the hand was palmar, the bottom of the foot, plantar. It's important to know the difference between superior and inferior. Superior is at the top, inferior is at the bottom. That's when we're talking about the body as a whole. But when we look at parts, when we look at the upper extremity, or we look at the lower limb or lower extremity, we don't use the word superior and inferior. We use the word proximal and distal. Proximal and distal. When we're furthest away in that limb, we use the word distal, like distant. And then when we are at the more proximal part, meaning towards the beginning of it, we say proximal. So here is the head of the humerus, which is proximal. And if I move to the end or the distal part of the humerus, I get to the cubital fossa. If I move furtherly distal, now I'm at the phalanges. So the phalanges are distal to the shoulder. If I'm at the fingers and I'm moving proximally, I'm moving towards the head of the humerus again. Now we have medial and lateral. So when we're moving towards the midline of the body, you're moving medially. And when you're moving away from midline, you're moving laterally. So medial and lateral. Again, in reference to the entire body, superior and inferior, when we're talking about the trunk, everything in the center here, excluding the extremities, when you're moving to the front, you're moving anteriorly. When you're moving to the back, you're moving posteriorly. AKA for anterior, it's also known as ventral. AKA for posterior, it's also known as dorsal, just like the dorsal fin of a shark. When we talk about the head and the tail, we don't say superior and inferior, we say cranial and caudal. If we're moving caudally, we're moving to where the tail is. If we're moving cranially, you're moving towards the cranium or the skull. Okay, good place to take a break. When we come back, we'll talk about the 4 quadrants and the 9 regions.